Types of headache. What is a headache? A headache is a pain or discomfort in the head or face. Headaches don't originate from the brain itself, as the brain and skull lacks pain-sensing nerves. Instead, headaches arise from pain-sensitive nerves in the head and neck. These nerves can be triggered by various factors like muscle tension, blood vessel changes, or nerve signals. These nerves then send pain signals to the brain, resulting in the sensation of headache pain. How is a headache formed? Headache involves the following pathway. Pain receptors are involved. Pain-sensitive nerves are located in the muscles, blood vessels, and tissue surrounding the brain and skull. Triggers activate nerves. Various factors can trigger these pain receptors, leading to headaches. Pain signals are transmitted. When these pain receptors are activated, they send pain signals along nerve pathways to the brain. The brain interprets the signals. The brain then interprets these signals as pain, and you experience a headache. In essence, a headache is a communication error between the pain-sensitive nerves and the brain, where the brain interprets a signal of pain, originating from elsewhere in the head or neck. What is primary and secondary headache? Headaches are broadly categorized into primary and secondary headache. Primary headaches occur independently and these are not caused by an underlying medical condition. Common types include migraines, tension headaches, and cluster headaches. Secondary headaches. These are caused by an underlying medical condition, such as infections, head injuries, tumors, or blood vessel problems. Common types include sinus headache and thunderclap headaches. Let's discuss common types of headache. There are many different types of headaches, but common types include migraine headache, tension headache, cluster headache, sinus headache, and thunderclap headache. Let's discuss it in details. Migraine headache. Migraines are moderate to severe headaches that can cause throbbing pain, often on one side of the head. It may be accompanied by nausea, vomiting, and sensitivity to light and sound. Some individuals experience aura symptoms before or during a migraine, such as visual disturbances, tingling, or numbness. These are thought to be related to the spreading wave of electrical activity in the brain. Tension headache. It is the most common type of headache. A tension headache causes mild to moderate pain that's often described as feeling like a tight band around the head. It is described as a dull, aching pain on both sides of the head, sometimes with tenderness in the neck and scalp. Tension headaches occur when neck and scalp muscles become tense or contract. The muscle contractions can be a response to stress, depression, head injury, or anxiety. Cluster headache. A cluster headache is an uncommon type of headache. Cluster headaches are named for their characteristic pattern of occurring in clusters or groups of attacks, separated by periods of remission. These painful episodes typically happen at the same time of day for a period of weeks or months, then disappear for a while, only to return in another cluster later. For example, a person might experience daily headaches for a couple of months, then have no headaches for a year or more. These headaches are characterized by intense, sharp pain, usually around one eye, and can be accompanied by watery eyes, a runny nose, and a drooping eyelid. And they can occur in clusters of multiple headaches per day. Sinus headache. A sinus headache is a type of headache, often associated with sinus infections, sinusitis. It is characterized by pain and pressure in the face, particularly around the forehead, cheeks, and nose. While commonly mistaken for migraines, sinus headaches are typically caused by inflammation or infection of the sinuses, leading to congestion and pressure buildup. Thunderclap headache. A thunderclap headache is a severe headache, that reaches maximum intensity within 1 minute. It's often described as the worst headache of my life, and can be a symptom of serious, potentially life-threatening conditions. While many thunderclap headaches are linked to subarachnoid hemorrhage, bleeding in the space around the brain, other causes include stroke, aneurysm, reversible cerebral vasoconstriction syndrome, arterial dissection, and even benign conditions.